Hello, nursing 447 issues and trends facing healthcare. My name is Nick Bartholomew, fellow nursing student. My nursing issue is nurse preceptorship. So a little background on preceptorship. We essentially have preceptors from the day we are born. Our parents kind of show us how to eat, go to the bathroom, take care of ourselves, interact with humans. Our friends show us, the cool place to hang out, show us our way through school, where to eat lunch, where to sit, all that stuff. Our very first jobs, we usually follow someone around, kind of showing us the ropes. Specifically, preceptorship is defined as a close relationship of a fixed duration where a more experienced colleague provides support to a less experienced colleague in order to develop their clinical skills, competence, and confidence in a specific field within a profession. Basically, the only way to learn how to be a bedside nurse is through preceptorship. I have yet to meet a nurse that has learned all the clinical skills from online training or audiobook. We have to learn by typically a one-on-one orientation, preceptorship, if you will. There are multiple components of nurse preceptorship. First would be the length. How long does the new nurse need to orient? A few days, a few weeks, maybe a couple months. Could depend on if they have prior patient care experience, if they were a ADN student, a BSN student. These are all kind of new nurse specific, but they're things to think about. Second, the location of the job. Is the new nurse going to be working on a med-surg floor? Are they going to be working long-term care? Are they working, in the operating room, ICU? Different locations require different amount of time and typically are given different amounts of time for their orientation. Third, the time of day. Working in the hospital and long-term care facilities, most jobs are 24/7, and most new graduates work nights typically. So is it beneficial for the new graduate to orient on nights, or do you split time between day and nights so the new graduate gets a feel for the unit? Factoring into that is the number of preceptors. So if the new nurse is going to bounce back between days and nights, are they going to have one preceptor the whole time? They're going to have multiple. What happens if the preceptor's sick? Do they also stay home sick or do some book work, or do they come in and have yet another preceptor? And then 5, competency expectations. Is the new graduate nurse expected at the end of the orientation to be 100% competent without, and how much autonomy, independence is required of them? This is kind of red herring, if you will. Obviously, the goal would be for everyone to be 100% competent, but as we all know, we all constantly learn and constantly see new things every day, no matter how long we've been CNAs, LPNs, RNs. As I mentioned in the previous slide, there's also different types of preceptorships. This PowerPoint will primarily focus on new graduate RN orientation, which would be someone who had just finished their ADN or BSN program, working in their very first nursing job. But there are also LPN to RN orientations, that have been working as RNs that are new to a different unit in the same hospital, or working RNs who move facilities, or maybe they move from long-term care to the hospital. These situations typically have different orientation times. As I said before, this PowerPoint will mainly focus on new graduate orientation. And by the way, I've been using orientation and preceptorship kind of interchangeably. They essentially mean the same thing. Also, this PowerPoint will mainly be focusing on new graduate orientation in the hospital setting, as that is what I am most familiar with, and that is where a bulk of our patients see most of their care. That all being said, there are different stages of preceptorship. Typically, first, you do some onboarding, some book work, computer work, do your BLS. That is all done before even stepping foot in the hospital most days. Typically, this is followed with some unit orientation, some basic hospital orientation. They show you where to badge in, badge out, where you meet for huddle, that kind of thing. This is typically followed in the following days with your first day in scrubs, where you are on the unit, you kind of learn where things are. Maybe you're just shadowing, following around. Typically moving into your one-on-one preceptorship time, in which expectations are set. You begin to take simple patients, do assessments, chart assessments, moving into like unit procedures, so like taking people to OR, taking people to imaging, branching off into more complex patients that are seen on your unit. Then the new graduate typically moves into the final stage of their orientation, in which they have their own assignment with a preceptor who is taking a lesser assignment. So if it was like med-surg, maybe the orientee would take 3 patients, and then the preceptor would take 1 or 2. That way they could be available to help. And that's finally followed with being the new graduate coming off orientation and then taking their own independent assignment. Benefits of increased orientation time. So, new graduate nurses have a lot to learn in a little amount of time, regardless of how long the orientation time is. However, the longer orientation time we give them, the more they are capable of learning and the more competent they will be at their job. If it's set as an expectation in the beginning of orientation that there is no deadline that the new nurse has to be off orientation in a set period, they will feel less pressure, and that way they will feel more supported, and it's conducive for a better learning environment. The same can be said for preceptors. If the unit and hospital system allows them a undetermined, as long as they need, amount of time to orientate, they will also feel less pressure and then can actually educate instead of rushing through and missing things and just feeling all that increased pressure from the deadline of having to be done in 2, 4, 6 weeks. And then my favorite saying from Cal Ripken Jr. is perfect practice makes perfect. So not feeling rushed, being able to take the time to sit and educate, to go over bookwork, to actually teach and ask questions, ultimately makes everyone better nurses, including the preceptors, which is at the end of the day safer for our patients. Benefits of decreased orientation time. So in the literature, the number one proponent for decreased orientation time is its decreased cost to the healthcare hospital system, organization, whatever you want to call it. Because essentially, as long as a new graduate nurse is on orientation, you are paying the preceptor, so 1 salary, and the new graduate nurse a 2nd salary to take care of the same amount of patients. So basically your costs are 100% increased. One of the other pieces from the literature that argue in favor of decreased orientation time would be that the quicker that the nurse is oriented, the quicker that they can be put into staffing ratios, and therefore decreasing staffing ratios for the rest of the unit. Also, another proponent for decreased orientation time is that at the end of the day, as we all know, there is no way to come off orientation as a 100% competent nurse who never has to ask a question, who is never wrong, and knows how to do everything. A lot of those things we have to just say we are competent, we are safe, and we as nurses learn by doing and are capable of asking the questions when they need to be asked, and there's no way to know everything. This slide goes over one of the bigger things from the literature, basically arguing that the most important factor of orientation time is cost. So decreased orientation time would, as I said in the previous slide, would lend itself towards decreased cost, the less time you have to pay two people to take care of the same patients. However, this also in hand goes with decreased safety. Speeding through orientees through training is a risk to the patient and liability to the healthcare organization, because these nurses may or may not be competent, may or may not be familiar with orientation, with hospital policies, ultimately being unsafe for patients. Arguments in favor of increased orientation time lend itself to increased costs. So as I had said, the hospital system has to pay two nurses' salary, which, as we know, at the end of the day is less than the cost of an MRI. However, I would argue, and the literature argues, that increased orientation time increases patient safety. So the nurse will, in theory, be more competent, feel educated, provide appropriate care, and at the end of the day, probably cost the organization less if they are not going to harm a patient and cause a lawsuit. But at the end of the day, as we all know, these are our nursing license, and although the organization's liable, ultimately we are the ones with the patient's lives in our hands and liable for malpractice. So some nursing considerations for preceptorship. As former orientees, future orientees, former preceptors, future preceptors, it is our job to be stewards for the nursing profession. I feel like we should argue in favor of appropriate orientation time because the healthcare system will continue to try and shortchange us and try and do more with less. And at the end of the day, it's our responsibility to push back. This kind of goes into benefits, maleficence. We should do good and try not to do harm. And ultimately, I firmly believe that having competent nurses through appropriate orientation time is a big factor in that. And as nurses, we're educators. We educate our patients. We educate family. We educate each other. So we should take pride in the fact that we are preceptors and orientees and always learning. So that I truly believe in that. And at the end of the day, like I have previously said, and we'll say probably 7 more times in this PowerPoint slide, it is our nursing license. We need to protect it. If you feel that you are not up to speed, it's up to you to say something and up to you to voice your need for further orientation, and the same for your orientees. If they need more, you shouldn't just pass them through because that's what we do. Everybody gets 5 weeks and that's it. That's at the end of the day, it's your license on the line. Some things to think about for preceptors: their compatibility with orientees. Obviously, you don't want to put two people who would butt heads together. As a preceptor, you should be able to teach to multiple different learning styles. If someone is not receptive to being overbearing, you should be able to, have a softer hand. Obviously, this is some people just don't gel, but if that's occurring, then the preceptor, as the typically elder statesman, should let the manager in charge know that their orientee needs a different preceptor. And then flexible scheduling, this more has to do with like the orientees going between nights and days. Sometimes units ask the preceptor to do that. I'm not sure that's the case in all situations. And ultimately, just be patient. We were all that new graduate nurse, wet behind our ears, not knowing how to start IVs, put Foleys in, talk to patients. A lot of people, this is their first job. So having those human interaction skills, we were all there once. So sometimes I think it's easy for us to forget that. This slide touches on some of the things that I've stated previously, that we should be some future concerns. So we should be stewards for the future nursing generations, leave the nursing profession better than how we found it. Healthcare and medical systems are getting more complex. There's more technology, more equipment. We can keep people alive longer. So we need more orientation time to learn how to do all these things. Also, I've kind of seen this a lot through COVID. A lot of my coworkers, this is their very first job. They are 18, well, they're 20, whatever years old. Less nurses are CNAs and have patient care experience before coming to work in the hospital. So a lot of these basic skills need to be taught. And then this final bullet point I actually had was brought to my attention by a coworker is that with Medicare, Medicaid, Obamacare, healthcare is becoming more widely available, which is a good thing. We're able to help more people. However, that requires more nurses. So as we need more nurses, we're going to orientate and precept more. I just wanted to share my personal preceptor experiences really quickly. Both are at level 1 trauma centers. So my hospital A, my first ever nursing job, I worked trauma surgical ICU. It was great. I worked as an intern. I knew where everything was. I personally was a friend with my preceptor, got really sick patients, had a full 12 weeks of orientation. Honestly enjoyed the heck out of it. Was asked to start precepting new grads within a year, and I learned very quickly that orienting is very hard and a lot of people do not know anything. So it's hard to keep eyes on people with things that you take for granted. I moved to Hospital B about 8 months after that. I still currently work at both, but so my second ever nursing job, so I actually went into orientation knowing a little bit, and the organization asked me to take 2 weeks of orientation, and I said absolutely not. I want 12 because it was a cardiothoracic ICU, so I was very heart illiterate in a whole new hospital system. So I had to learn where everything was, and new charting system. Meditech's the worst, as we all know. However, I did come off orientation a little early by week 8, and I've not been asked to precept yet, but I am looking forward to it in the future. Finally, my personal beliefs on preceptorship. I personally think longer orientation is great for everybody. The learning, the less stress. At the end of the day, our patient safety is paramount, and if that long orientation is safe for your patients, that's what matters. Also, you can just never be prepared for everything. We have to critically think and ask questions and plan ahead, and successful nurses do those things. We are never ever done learning or adapting, so never think you know everything. And here are my sources. Thanks so much. It's been a great 8 weeks.